Do you frequently feel like your heart pains sometimes? Or maybe you've been extra tired lately, even after a full night's sleep. While those could be signs of many things, sometimes they're linked to conditions involving your blood. One such rare condition is basophilia. Basophilia means you have too many basophils in your blood. Basophils are a type of white blood cell. Think of them as tiny soldiers helping your body fight allergies and infections. When there are too many, it can be a sign that something else is going on inside your body. Have you ever had a blood test that came back with strange numbers? That's often how doctors first spot basophilia. Great question. Basophilia isn't usually a disease by itself. It's more like a red flag. Common causes include long-term inflammation, like in rheumatoid arthritis or severe allergies. Think of someone who breaks into a rash every time they eat shellfish. Certain infections, especially parasitic ones, like worms from undercooked food, can also trigger it. Another big cause is bone marrow disorders. Imagine your bone marrow as a factory making blood cells. If the factory's machine gets a glitch, like in chronic myeloid leukemia (CML), it starts making too many basophils. Medications like estrogen therapy can also play a role. So if your doctor finds basophilia, they'll start asking, what's causing the factory to overproduce? Now here's the tricky part. Basophilia itself doesn't shout its presence. You won't wake up and say, I have too many basophils. Instead, you feel symptoms from whatever's causing it. For example, if it's due to an allergy, you might have itchy skin hives or trouble breathing. If it's a bone marrow problem, you could feel weak, lose weight without trying or notice. Your belly feels full because your spleen is swollen. Have you ever felt unexplained belly discomfort or night sweats? Those could be clues. Some people don't feel anything at all. It's found only during routine blood work. That's why a simple blood test can sometimes uncover hidden issues. So how do doctors find basophilia? First, they take a blood sample, that little prick on your finger or arm. The lab checks your complete blood count (CBC), which counts all your blood cells. If basophils are higher than normal, usually more than 200 per microliter, that's a sign. But then comes the detective work. Why? The doctor might order more tests like checking for CML with a genetic test, looking for the Philadelphia chromosome, or testing for parasites in your stool. Imaging like an ultrasound of your belly might check your spleen size. Treatment, it's not about reducing basophils directly, it's about treating the cause. If it's an allergy, you avoid triggers and use antihistamines. If it's leukemia, you might need chemotherapy or targeted drugs. You're not treating the number, you're treating the story behind it. Can you prevent basophilia? Well, since it's a sign, not a disease, you focus on preventing or managing the triggers. Eat well-cooked food to avoid parasites. Manage your allergies. Know your triggers and carry medication if needed. If you have a chronic condition like rheumatoid arthritis, stick to your treatment plan. Regular health checkups with blood tests help catch issues early. Think of it like car maintenance. You don't wait for the engine to break down. Get your body checkup even when you feel fine. Avoid smoking and excessive alcohol. They stress your body and blood system. Prevention is really about listening to your body and staying one step ahead. Recent research is shining a light on basophils like never before. Scientists once thought these cells were just allergy helpers, but now they're learning they play roles in immune regulation and even fighting tumors. New targeted therapies for blood cancers, like tyrosine kinase inhibitors for CML, have made a big difference. They can bring basophil levels back to normal by fixing the broken factory. Researchers are also exploring how basophils talk to other immune cells, which might lead to new allergy or autoimmune treatments. Imagine a future where a blood test not only finds basophilia, but also tells exactly what's causing it using AI analysis. That's where science is heading: faster, smarter diagnosis, and personalized treatment plans.